Brian Boehme, physiotherapist here at Elite Sports Medicine. I'm going solo today. I feel almost naked without my buddy, Mike, Dr. Galbraith. I get to show you some mobility work for the forearm. We had just done a video that talked about some stretches, some exercises for tennis elbow type injury, lateral epicondylitis, that's a mouthful. But I'm going to show you some mobility work in these areas. Constantly as a physiotherapist, I see patients that have this issue with their elbows, but also have worries that they've got a lot of restriction, a lot of tension in some of these areas, and not just on, say, this side where a lot of symptoms can be, but I also find a lot of patients have tension, restrictions over on this side too, so I oftentimes have them treat both sides. I've got two different balls here. One's a lacrosse ball, which is much harder than, say, a tennis ball. I like using a lacrosse ball when I do this, but with a lot of patients, with how tender they are, a lot of them choose to use a tennis ball initially, and then they can graduate to a lacrosse ball as they feel like they can. So I'm going to give Mike, thank you. So right here, if I was going to treat, say, this area right here, if this is where a lot of the symptoms were, for lots of patients, I'll remind them this is meant to be somewhat aggressive, but always make sure it's tolerable. So lacrosse ball here, and I like, this is just how I like doing it. I like a door jam right here, but just because it stays in place, and I've got the freedom to move my wrist or my arm in the air here or wherever. So I'll just kind of show you. As I put that ball in this area, a lot of times it's just kind of in general. A lot of patients ask, oh, am I in the right area? If it's a little sore and tight, you're in the right area. I usually just suggest make sure you understand that if you're going to treat it, you're only treating one spot, then you move on. Treat that spot, then you move on. I'm not going to randomly go all over the place because the chance that I maybe treat the same spot numerous times could possibly mean that I bruise it instead of actually help release it. Hopefully that makes sense. But anyways, I'll have this hand here to help just hold it in place. You can tell that the lacrosse ball is right around my elbow, close to the bone, but just a little lower than it. And I'll just move. And as was shown in one of the previous videos, all you have to do to see some of these muscles is just wiggle your fingers or twist or move your hand, and you'll see those muscles working. And with the ball right here, you'll really feel that mobility and possible tension and soreness as you do these exercises. And then from here, I just move down a little bit, and I do it again. The nice thing about this is I can really change the direction, change the position, change what I want to do, flexion, extension, or rotation, even just the fingers moving, and I can go right on down the chain. A lot of patients are quite surprised how much tension there is quite down or quite far down towards the wrist. The nice thing about it is I can change my angle and come into areas like this. And same idea, motions really doesn't change, it just depends on what you feel. But each spot I get, I usually will suggest to a patient, you're going to do 5 to 10 motions, good chance that you'll get some good release, but less likely to irritate something overly. And then from here, like I said, I come to different spots. I could even go on the inside. And a lot of patients are quite surprised, as I said, how tight some of these areas are. But as I mentioned before, the motions don't change because all these muscles that we're working on right now help to control the fingers, the wrist, forearm, all these different areas. So for a lot of patients, it actually feels quite good. But remember, it can be quite aggressive. So just be careful as you do it. Each spot you get, you're only doing once to remind you, and only doing about 5 to 10 repetitions on that spot. Then move on, do it again, move on, do it again. And you're only doing that maybe 2-3 times a week because it's aggressive. Thank you very much for joining us.